Hello, my beloveds. Welcome back to Workshop 4 of the Sexual Foundations Masterclass for people with a pussy. In this class, which I'm calling Pleasure, Power, and Perimenopause, we are going to talk about sex and aging, why we've been lied to about this as women, and all the different ways that you can use your pleasure as medicine to help guide you through your 40s, 50s, 60s, and beyond so that you can become the most vibrant, pleasure-filled, sexual version of yourself well into your golden years. So if you have not yet watched Workshop 1, 2, and 3, please go back and watch those where we talk about the anatomy of desire, how you can understand your erotic mosaic, that is all the beautiful things that make you you sexually. We also talked about organic arousal, which is the kind of unwinding of the kind of escalator, the sexual escalator, and learning to follow your own slow, organic arousal and sensation flow. When we start to take control of those aspects of our sexuality, it can set us free in so many ways. Workshop 3 was a combined workshop for all bodies, talking about shame, stigma, and trauma. If you have not yet gone to therapy, done psychedelics, explored coaching to work with some of the shame, stigma, and trauma that often comes up when we explore sexuality, this is a great place to start, and it invites you into a deeper conversation with yourself about all the different things that might be holding us back. This impacts so many of us in such a multi-layered way. So if you've not yet done the self-inquiry to explore your sexuality through the lens of what you might have learned, how you might have been taught to be sexual, what might be expected of your body, this is a really good thing to go back and listen to. I will link those all below. And in this workshop, we are going to talk about how to take all the stuff we learned in workshop 1, 2, 3 and bring it together and pair it with all of the information that you need to know about aging gracefully, aging wildly, and aging in a way that is pleasure-filled and delicious for whatever that looks like for you. So the first thing to really know is, as I said in the very beginning, we have really been lied to about sex and pleasure. Media, pornography, literature, literally everything kind of in pop culture tells us that women are no longer beautiful or valuable or sexy after, 35 or 40? And it does such a huge disservice, not only to our kind of sense of beauty and our sense of self-worth, but also this kind of underlying, deep schism in kind of who we are from we are only shown people who are 20 and 25 and 30 as the benchmark for what's sexual and what's beautiful. And if you are anywhere close to my age, which is 45, you know that things are just going to get better as we get older. I feel so much more confident in my body now than I ever did as a 20-year-old or a 30-year-old. I feel so much more in tune with my sexuality for myself than I ever did. I grew up really learning that my sex was something I offered people. It wasn't really something for me, that my pleasure was something that was a gift to give others rather than something that I would do to really nourish myself. And so in my 40s, I've been able to reclaim all of that. And I am genuinely excited about getting older and getting sexier. I really think that this is possible, and this workshop will give you some of the tools and some of the baseline information that you need so that you can age, again, not just gracefully, but powerfully and sexy in a sexy way. So I'm going to share the best information I have about hormones, about perimenopause, about pleasure as medicine, about all the ways we need to take care of our pussy as we age. I also want to just notate, and this is written as well, I am not a medical doctor, so I am not here to diagnose or treat anything that may be happening in your body. Please consider this for information only. If you have questions, I'm happy to answer them and refer you out. I don't prescribe anything, I don't offer anything, and none of this is to be construed as medical advice. So we are going to talk about hormones, and we are also going to talk about the tools and practices and other ways that you can stay tuned in and care for your body so that it can be as strong, as vibrant, and as juicy as possible. We'll talk lube, we'll talk toys, we'll talk practices, all sorts of things that will help you get kind of moving in this wonderful direction. I also want to just make space that there may be people who are over it. They've spent their 20s, 30s, maybe their 40s and 50s having sex that they don't want, giving away their bodies and their time and their expression to other partners, to making babies and breastfeeding babies. And you might get to a point in your life where you actually don't want to have sex. You don't want to follow this path. If that is you, I see you and I hear you. And I still invite you to stay in this workshop, and especially go back to workshop 1 and 2, maybe 3 also, because so many people, as we reach our 40s and 50s, it's not that we start to dislike sex per se, it's that we so often dislike the sex that is on the menu. And again, if you were raised in a culture, which most of us were, that tells us sex is not our own, that our bodies are for other people, that our bodies are vessels for the next generation, then you might not have a great relationship with your sexual self because it's always been kind of externalized. So I want to make space for that being very real and very true in a lot of people. And I want you to hold the possibility that if sex was just for you, if pleasure was just for you, would you enjoy it more? If you didn't have to have sex with someone out of duty, out of obligation, because it's a to-do list item to caretake somebody else's needs, if you didn't have to give your body's energy and your literal life force through breast milk or holding or caretaking of others, how would you reclaim your body for you? There's a lot of people when they get to 40 and 50 and they start to reevaluate the things that they've been doing, the people that they're with, the practices that they do or don't do, and really kind of have a come back to the self moment, right? In popular culture, we would call it a midlife crisis, but which has kind of a negative undertone, but I would call it potentially a reawakening, right? So many people talk about perimenopause as a portal to really get back to yourself and get to a point where you do not give a fuck about other people. Again, we have spent so much of our time over giving, over caretaking, and not tending to ourselves that in our 40s and 50s, especially through the perimenopause portal, we have a chance to stop all of that or reevaluate all of it. And so if you're listening to this and you're like, I hate sex, I've never liked sex, I don't want to do this, great, I hear you. And I really invite you to just be curious about what comes up as you listen. Maybe you explore some of the practices. Maybe you tend to your body in some different ways. And maybe once you stop giving so many fucks about other people, you can come back to your own pleasure. There are people who are absolutely asexual, who don't want to masturbate, who don't want to have sex, maybe don't want to have relationships. Totally normal. And in my experience, it's often that we don't want what's there. So as you listen to this, just see where you fit on that spectrum. Okay, so the first thing we're going to do is talk about perimenopause and hormones. There is the holy trinity of sexual self-care that I want you to always remember and to practice every day. And this is hydrate, lubricate, masturbate. And a bonus one is hormones, which we'll talk about more in a moment. You have a beautiful skincare routine, I'm sure. Many different products, different days of the week. Take care of your skin every day. And it is the same with our vulva. The skin changes as we get older. Our bodies need more nourishment from the outside in. There are multiple different ways to hydrate. You can use water-based kind of suppositories or different topicals that help you do that. My personal favorite is coconut oil, just as like a topical moisturizer. Let me get the puppet. So you can moisturize the outer labia, definitely the hood and the inner labia, and definitely the spot right here around the urethra and the vaginal opening, making sure that those soft, tender tissues are well hydrated is very important to maintaining elasticity, maintaining health, reducing friction, reducing pain, and reducing chance of infection through cuts or something like that. And when you self-pleasure, when you have partnered sex, when you touch your vulva, you need to lubricate. And this is something that I am noticing more and more. So now I'm 45 and I am not as juicy as I was, just kind of as a baseline. And so now anytime I touch myself, anytime my partner touches me, I always want to use some lube, especially on the outer labia and the inner labia. I'm often wet inside my vagina, but the outer parts definitely need a little bit more moisture in order to, again, reduce friction, make it feel better, kind of create more glide, and just create more pleasurable sensations. The other part is to masturbate. And this is where it sounds really trite, but it really is a use it or lose it. We have to exercise this part of our body. We have to literally exercise our pleasure practice, our pleasure muscle. And this is especially important when we talk about hormones, which I'll get to in a moment, but our clitoris and our labia may shift and change over time. We may have an increase of, again, kind of dryness and sensitivity. We may lose some of the elasticity, especially if we don't utilize penetration and self-touch to kind of keep things active and juicy. And we may also experience an increase in our orgasmic threshold, which means that it's going to be harder to have an orgasm using the same stimulation that you always used, right? So let's say you used to be able to masturbate for 5 minutes and have an orgasm that way. That might change and might become 7 minutes or 8 minutes, or a little bit of a stronger impulse on the vibrator, or a little bit more added sensation. Like maybe it's not just clitoral, maybe you also need to add penetration, right? So your orgasmic threshold may increase. That is okay, that is normal, and it's about learning to work with that over time. But maintaining your connection to your sexual self is not only mentally and kind of sexually good for you because it helps you remain connected to this life force energy, but it also literally helps keep your tissues healthier. And if you take 10 years off of masturbating, you may find that your clitoris isn't as sensitive. You may find that your vaginal opening has gotten a little tighter or a little bit less pliable, right? So literally pleasure is medicine for keeping your pussy juicy, healthy, and in a pleasurable state. We also want to kind of simultaneously, while experiencing pleasure, self-touch, partner pleasure, masturbation, all the different ways, we also want to practice in our minds and in our communication with our beloveds, really rewriting what sex can be, especially for heteronormative couples, for heterosexual couples. Sex is primarily focused on penis and vagina intercourse. And as your hormones shift and your vaginal tissues and vulvular tissues start to change, penetration may be more difficult, it may be off the table entirely, and or it may be only available certain times, right? Once you're aroused enough, if you've had enough cannabis, if you are, turned on enough, etc. So really starting now, when you're in your 20s or 30s or 40s, kind of reimagining what sex can be is going to be a really powerful way to make sure that you can maintain your sexuality throughout the decades. If we only focus on penetration as like the real sex or the only thing that counts, not only are we missing out on all of this pleasure, right? So again, go back to video 1 to see why it's so important to focus on slow arousal for people with pussies and understanding the clitoral complex. But if we've changed the focus of sex from we got to put a penis inside something into something like, where do we find the pleasure? Can we make out for an hour? Can we explore oral sex and be, done? Is that enough if we mutually masturbate together? There are so many ways to explore sex that are beyond penis and vagina intercourse that can really make your sex better, especially if you have a partner who is also aging and going through their own changes, whether they have a penis or a vulva. They are going to go through their own changes, and rewriting what sex is possible with your current bodies is going to be so valuable, and to ensure that you're still getting down when you're 60, 70, and 80. The other thing, and I know that this is annoying to talk about as part of a sex workshop, but really some of the best things you can do are building creating the good building blocks for your body, which include like a fabulous diet, probably some supplements and vitamins, and exercise. Not only is exercise good for our bones, our cardiovascular health, our brain function, also exercise increases blood flow. Increased blood flow creates more sensation. So even if you are exercising your arms and legs and your abs, you are still getting increased blood flow to your genitals. More blood flow equals more arousal, equals more sensation. So if you are sedentary, it is a great time to start working on caring for your whole body in service of caring for your sexual self. I started weightlifting almost a year ago. I was always a yogi and a surfer, and it was super intimidating for me to get into the gym. I hired a personal trainer. I started working out once or twice a week, and I still do yoga, and I do a bunch of walking, and all of this is not only good for me now, it makes me feel better day to day, but it also is very much an insurance policy so that I am lifting heavy things to literally protect my bones and protect my brain for when I'm 50, 60, 70, and beyond. I also take a bunch of supplements, and I'll link below to a perimenopausal post that I wrote a while ago about like all the different supplements I take. Again, this is not medical advice, I'm not diagnosing you, but it's good to see a functional medicine or a primary care doctor to help look at what else is going on in your body. Maybe it's thyroid, maybe it's omegas, maybe it's vitamin or mineral deficiencies, maybe it's digestive, maybe it's bowel. There's so many different things that could go on that can impact us in all these different ways. So please take care of yourself and know that that is all connected. So the other thing I want to talk about is our pelvic floor. And we often hear about pelvic floor when we start to have problems, but our pelvic floor is absolutely very important to our pleasure. So our pelvic floor is a collection of muscles, also called the pubococcygeus muscles, or PC muscles, that work like a sling, kind of holding up all of our reproductive and elimination organs, right? So it's a collection of muscles that connects from your pubic bone all the way kind of in and around your body, back towards connects to your glute and connects to the inner part of your thighs, the inner part of your hips. I need to get a model for the pelvic floor, so it's on the list. You can work with these muscles right now, in this moment, by imagining that you have a blueberry inside your vagina. Do not put a blueberry inside your vagina, just imagine it. And I want you to imagine that you pull it up towards your belly button, almost like you're kind of pulling up the blueberry towards your belly button. So you're kind of squeezing and lifting the kind of vaginal canal and kind of lifting all of those muscles, and then fully relax, and then lift again, and then fully relax. We do not want a very tight pelvic floor, but we also do not want a very loose pelvic floor. Both of those things can lead to urinary and bowel incontinence. They can lead to prolapse, where the organs kind of fall out of their natural position. And it can also, a strong pelvic floor can lead to better orgasms and better pleasure. When this collection of muscles when it's toned, right? Just like our muscles, we want them to be toned because they're, working out and stretching and relaxing and building. We need to have that same resiliency in our pelvic floor, almost like a trampoline, right? It bounces up, it relaxes down, bounces up, relaxes down. Urinary incontinence we're hearing about it a lot more. It's much more common than it used to be, but this does not mean that it is normal. This is preventable, and it can be really powerful to work with a pelvic floor physical therapist or another physical therapist to help you get in touch with your pelvic floor and understand how it works, and also learn how to maintain the health of your pelvic floor. You may have heard of Kegels, which are the exercises of squeezing, right? But for some people, those are contraindicated, because if your pelvic floor is very tight, you do not want to be squeezing it more. Instead, the practice is to learn to relax. So if you have, pain or tightness with any sort of penetration, if it feels like it's hard to pee, if it feels like it's hard to have a bowel movement and you feel constipated, you may have what's called a hypertonic or an overly tight pelvic floor. You can absolutely work on this. This is not a sentence. And it's really important to learn to take care of this part of our body. And in the worksheet I've created, there is a pelvic floor exercise that you can practice to pair with your breathing. There's also a practice that I teach called ecstatic breath work, which is when you learn to engage your pelvic floor with your breath. And you start to imagine the energy moving, and you can start to turn yourself on and start to feel arousal build in your body, totally hands-free. So if that interests you, please reach out. I offer mini sessions teaching people how to do this. Super fun. Okay, so talked about the trifecta: hydrate, lubricate, masturbate. We talked about diet and exercise. I know nobody ever wants to hear about how to have to change their diet, including me. We talked about pelvic floor. So these are some of the foundational things that you need to do for your health. The other thing I would like to talk about is really just like focusing on sex and aging. Like I said in the beginning, many of us get to a point where there's like zero fucks left, right? I'm tired of having sex that I don't want, tired of having sex I don't like, tired of giving my body over to other people. Great. And remember, pleasure and sex can be for you. But if you're in a situation or in a partnership where that's never been the case, it may take some unwinding to get there. It may take some hard conversations. It may take you really standing up for yourself in a different way. It may take you reclaiming your pleasure for yourself. And one of the most important things I want people to take away from this video and so much of my work is that sex should never, ever be painful. So many of us have been taught that we can suffer through it. We can muscle through it. We can just get it over with. We can just do it just for another few minutes. And I beg of you, please give yourself the grace and the spaciousness to stop having sex when it is painful. No matter how it pains you. Maybe it's that your knee is in a wrong position. Maybe it's that it hurts your back. Great, make adjustments. Do not suffer for sex. And more importantly, if it feels bad in your vulva, if it feels painful on the inner labia because there's too much friction, if it feels painful in the vaginal opening, whether that's a vestibulodynia, which is pain around the vestibule or the opening, or like a vulvodynia where your whole vulva hurts, none of that is acceptable any longer. You absolutely do not need to have sex if it hurts you. This might also be kind of subsequent pain, right? If you have sex and every time you get a UTI, or if you have sex and then it burns for 2 days after. That is not normal. And I just invite you so softly and so gently to be so kind to yourself and learn and practice saying no to sex that does not feel good. Not only because you do not deserve to feel pain, ever, especially in sex, but also because when we start to have sex that we don't like or that does not feel good, that we have to just muscle through it, we start to train our brain and our body to equate sex with something that is awful. And then in a year or 5 years, you may not want to have sex anymore because you have trained your body over and over that sex equals suffering. Sex should be and can be pleasurable and soft and slow. It does not have to hurt. If you are experiencing any pain, please go see a urologist, a gynecologist, an endocrinologist, maybe your primary care doctor. Not all of them are aware of menopausal and the symptoms that may go along with perimenopause and menopause. So check with your doctors. Make sure they understand what's happening in your vulva specifically that may be causing this pain. And please give yourself the gift of pain-free pleasure. Some of these symptoms, vulvodynia, vestibulodynia, may be hormone related. Maybe it's because you were on birth control pills for a really long time. Maybe it's because you're starting perimenopause or moving into menopause and the tissues themselves are changing. The tissues of our vulva, the clitoris, the inner labia, and this kind of vestibule area, the urethra included, where the urine comes out, these are testosterone and estrogen dependent. So our first hormone that declines in perimenopause, starting at 35 or 40, is testosterone. And this may impact your orgasmic threshold, like I was saying. It may impact your lubrication. It may impact your desire or libido. Testosterone is easy to add into your kind of supplement routine. I've been on testosterone for 2 years now. The worst impact is that I have a little bit more hair on my legs. And so I just got it all lasered off so I don't have to shave my thighs ever. It's such a pain in the ass. But when I started taking testosterone, I really felt my orgasm come back. I felt my sexual energy come back. I felt my creative and energetic, I felt like my brain power came back on. I was really struggling with stamina. I was really struggling with kind of creative energy. And when I started testosterone, it was like a power up, like kind of everything came back. Definitely kind of pretty hypersexual for a while. And that was really fun. So testosterone is not FDA approved for use in women. And there are dozens and hundreds of menopause doctors who say that it is safe, effective, easy, and so valuable for women to add into their perimenopause and menopause care routine. So part of the reason there might be pain is because of these shifting hormones. We also start to lose estrogen and progesterone during this time. Estrogen especially is important because this is impacted, these tissues here of the clitoris, the inside and the outside, the glands of the clitoris, but especially these tissues here. And I'm going to introduce you to something that sounds awful, and I wish nobody had to know what this was ever, but it is called the genital urinary syndrome of menopause, the GSM, also known as vaginal atrophy. And what this means is that if your tissues are not cared for hormonally, lubrication, hydration, and with use, they may start to shrink and or disappear. So when we are born, we do not have a defined clitoris, and we do not have as much kind of inner labia. It's more just like this kind of outer labia. And then when we go through puberty and all those hormones flush into our system, the clitoris and the inner labia develop. And as we start to lose our hormones, some of these tissues may shrink and or disappear. So again, if you stop having sex at 40 and at 60 you suddenly want to come back with no hormonal or sexual intervention, you may have literally less body parts to work with. And I know that sounds really scary. And I know that it can be really intimidating, especially if you've never heard about it before, but it is real. It is a documented fact. I noticed my doctors, when I did my first big exam, noticed that there was some shrinking of the interlabial tissue. And one of the other things that can happen is this is the clitoral hood, and everybody's is a little bit different. Some is more pronounced than others. Some have a smaller hood, some have a bigger hood, totally normal. In this particular one, you can see the hood kind of slides over the clitoris. And what happens is little adhesions develop so that the hood kind of stays stuck in place. And what this means is that as you get more turned on and your clitoris engorges with blood, it may create pain and or stiffness in the clitoris because the hood can't retract. And so we want the hood to be able to retract back and then cover it back up once we're done with pleasure. That may change as you start to lose your hormones in perimenopause. So it's really, really important to check in with a doctor, get yourself diagnosed, make sure you have the tools that you need. You are in control of your sexual health. You have to be an advocate for yourself because, again, most doctors don't know about this, and it's so important so that you can have delicious, pleasurable, pain-free sex into your 40s, 50s, 60s, and beyond. Again, lube is your best friend here. We always want to make sure that we're using lube when we're having play. And we also can utilize things like a cannabis-based lube, which can help increase blood flow, again, with the blood flow, creating more arousal, and can help you orgasm more easily and create just more delicious sensations. So some of the other toys and tools I want you to consider, and again, this is not medical advice, this is my experience and my research that I've done. So some of the things that have helped me a lot, again, I'm 45, I've been on hormones for a couple of years. Cannabis has been a really, really good friend, both for internally, for my mood swings, kind of keeping my mood buoyant, if you will, but also it helps me super relax and get more into sensation when I want to have sex. So you can take a little bit of an edible, you can smoke a little bit, you can take like a tincture or something if you don't like either of those, just to get the THC or the CBD into your system. The CBD is the non-psychoactive one. This may help you relax, turn off that volume of the anxiety in your brain and get more into your body and more into your sensation and your pleasure. So highly, highly recommend this. For some people, psychedelics and ketamine can be really impactful. I tried ketamine in a therapeutic setting about 6 months ago, and it felt at the time, and do not quote me on this, it felt like, I remember coming out of it and thinking, is ketamine a cure for perimenopause? Because it felt like it eliminated all of my symptoms, primarily mental, right? This kind of increased anxiety, increased depression. I felt like the ketamine lifted all of that and gave me all of my physical energy back. So ketamine is legal. It has never been illegal, and it is FDA approved to treat anxiety and depression and PTSD. So you can find a ketamine clinic or find a therapist that works with ketamine to help guide you onto this journey so that you, if you're interested, can explore this really powerful medicine. It's not a classic psychedelic, but it is a really strong dissociative. So it kind of takes you out of your body, you're kind of floating above it, and gives you, again, this like pretty amazing physical result. I liked my experience so much that I've actually signed up for additional ketamine-assisted therapy to help stave off anxiety and depression that have come over me in the past few months. And I'll be creating more content around what that ketamine journey is like over the summer. So stay tuned for that. The other thing that can be really helpful are different herbs that make you feel good, right? So I'm not an herbalist, so I'm not prescribing any of these, but Vitex can be really good. Chasteberry, red raspberry leaf, even chocolate can be really good for you as kind of like mood stabilizers. There are lots of different ways to approach your healthcare through this aging process. Some of you might choose to go the hormone route. Some of you might choose to go the herbal route or the natural route. Whatever you choose, I invite you into just like deep self-care of knowing what all of them are. And then hormones. So again, probably not for everyone. I am surprised as anyone that I became kind of such a hormone advocate. I was always a natural medicine girly. I was always a wellness person, an herbalist, like really into plants and how I don't need to take big pharma for anything. And it turns out that hormones are really fucking effective. So again, I've been on testosterone for about 2 years. That was the first one I started with. And then about 8 months ago, I started estrogen and progesterone. So estrogen helps keep your levels really good, helps keep those tissues healthy. It's also really good for your cognitive function, for your bone mass, so we don't lose our bones, helps your metabolism, helps you maintain your weight. Progesterone is necessary if you still have a uterus. So I still have my uterus, and progesterone is very protective for the endometrial lining. So if you're on estrogen and you have a uterus, you should definitely be taking progesterone. The estrogen is a little patch. I just put my patches on this morning. This is what they look like. You can barely see them. They're just little, tiny little invisible patches. And you can also do pellets. You can also do topical. There's lots of different ways to do it. So work with your doctor and figure out what's best for you. Progesterone is a tablet. I take it 3 times a week. It is not, our hormones are going through such fluctuations at this point. And so it's never like an exact science. And some people will say blood tests are the best. Some people will say blood tests don't give you the right information. Some people might recommend a Dutch test. I don't have the best recommendation, but I do invite you to work with your many different doctors, your care team, to figure out what feels best for you. You may start hormones and may need to adjust your dosing. I just adjusted my dosing a few weeks ago for my estrogen, and it made an enormous difference in terms of my anxiety and depression being lifted, and I feel really good. So hormones are a tool in the toolbox, along with the ketamine, the psychedelics, the cannabis, the herbs. Explore what you want. The other really great tool I want you to add into your toolbox are sex toys. If you don't yet have a collection of sex toys to play with, I really invite you to start your exploration. Whether it's an accessibility thing because it hurts your hand to masturbate for so long, which I'm getting to that point now, or ergonomic because you can't quite reach to put your fingers in where you want to put your fingers in. Toys can be super helpful, whether it's vibrators or suction or penetration. There are lots of different ways to explore your pleasure. And now, as you're kind of relearning sexuality in your 30s, 40s, 50s, now is a great time to start exploring. If you have questions about sex toys, I would be happy to answer them. I love having so many tools in my toolbox, and that can include things like blindfolds and feather gloves and kind of touchy-feely things for more of that sensation, but it also is dildos, vibrators, butt plugs, things like that that really add to my sensation and my stimulation. So sex toys are your friends. They are your allies in the bedroom. If you have a partner who thinks that they're competition or that you shouldn't need them, tell that person respectfully to fuck off and say, in the kitchen, you need multiple different types of spoons, spatulas, knives, and silverware. Same thing in the bedroom. In the tool shed, you need different types of wrenches and pliers and screwdrivers and hammers and things like that for different jobs. It's the same thing in the bedroom. We need different tools to help us get the stuff done that we want to get done. So sex toys are tools for your pleasure, and you deserve to have as many of them as you want in the bedroom to make sex fun, pleasurable, and comfortable. One of the things I want to talk about that's toy related, but not really toys, is something called dilators. Dilators are small, sometimes as small as your finger, even your pinky. Dilators usually come in a set, maybe 4 or 5 or 6 to a set, that help create more of an opening either in your vagina or in your anus. So if for some reason you have if you have, for example, a really tight pelvic floor and you experience a lot of pain with penetration, even like putting a tampon in hurts, then working with a pelvic floor physical therapist to help release some of that pelvic floor tension, and working probably with a gynecologist or a urologist to work with dilator set can really help you not only relax those muscles, but start to experience penetration with really small items, which then graduate up in size, right? So you would start with a small one, and then you would get to a little bigger one, and then you would get to a bigger one, so that you can slowly work with your muscles and your tissues to slowly expand your capacity for penetration, again, vaginally or anally. These can be really helpful tools, especially if you're already starting to feel some of the pain or some of the atrophy from decreased hormones as part of perimenopause. The dilators might be really helpful if you have that pain or if you're experiencing pain with penetration. The other thing I wanted to add to the hormones conversation is that testosterone, estrogen, and progesterone, these are all systemic. So I take them orally or I put them on my body. I also use every night a topical cream that is estradiol and testosterone. And it's a topical cream that I rub on my vulva that helps work just on those tissues. So if you are worried about breast cancer, if you've had breast cancer, or if you're susceptible to it through genes or whatever, the topical estrogen is very safe, even if you have those risks, because the topical estrogen that we would put on our vulva and on our labia and in our vagina does not impact you systemically. So this is really important to know, because so many people have a fear of hormones based on a debunked and outdated study from the 80s that tells us that when we take hormones, it increases our risk of breast cancer. This is not true. And those kind of legacy false misinformation kind of continues, right? So if you are really struggling with pain, if you are struggling with frequent and or recurrent yeast infections or urinary tract infections, topical hormones can help. And you can be on topical hormones until the day you die, because they are so health preventative when it comes to preventing UTIs, preventing pain, preventing all sorts of other problems in our vulva that we may face as we age. So topical is really very, very important. The final thing I will add to this is, again, back to this idea of kind of reimagining sex. Like, sex may not look the way it did 10 years ago, 20 years ago, 30 years ago, and that's okay. Your diet doesn't look the same, your exercise habits don't look the same, your sleep habits don't look the same. So of course our sex should change. And I invite you into a slower, more organic arousal process. Maybe it's with toys, maybe it's with sensation-based experiences. There's a mindful erotic practice exercise in the worksheet that I invite you into, and you can play with that in a lot of different ways. Maybe you play with it listening to music. Maybe you play with it with your eyes blindfolded. Maybe you play with it with a partner, where you explore your body in front of a partner and get to know your pleasure self in that way. Learning to slow down, learning to explore sensation and not just direct genital touch can be a huge benefit towards rewriting those sex scripts that are, for so many of us, outdated. So sensation play, finding pleasure mapping practices, creating your own space for mindful erotic practice, like slow self-pleasure practice. This is going to be the way that you set your sex free for the decades to come. I so welcome questions and comments about this video. This is one of my favorite subjects to talk about. If you have a partner with a penis, please go watch the other video I just made about sex and aging for people with penises, because they have their own concerns to talk about. If you are struggling with pain, with penetration, with rewriting your sex narratives, I am here to help. I love talking about this stuff and offering education and skills building for people who are ready to take control of their sex life and really age so sexily into the future. Age so gracefully, age so ecstatically, age with so much pleasure in your system. I invite you in to all of this. Thank you for being here. Please pass on this information to other people, and may we all continue to be free and full of pleasure.